I welcome you all to the episode number 4 of Autism DocTalk from Horse's Mouth. This is the platform wherein we interact with the experts, healthcare providers, and other service providers who cater to autistic individuals and their caregivers. So, the detail about the platform has been shared in the description box, as well as a link might appear somewhere here. So, this is a brief disclaimer wherein we insist that whatever information is shared here is not to be considered as individual medical advice. For the same, you can contact to your medical practitioners. Okay. So today it is going to be a special day because today we are going to interact with such a faculty, with an expert who have been there with the healthcare for a long time, but that faculty, that particular field is not much aware, and that is pediatric neurology. So, who these guys are, what they do, which cases are to be referred to them, and what expertise do they have? Let us hear it from someone very special. Her name is Dr. P. Keerthi Kundana, and the special introduction of her is she is my junior, and I remember whichever subject she had chosen or whichever subject she had appeared for, she topped in each and everything. Who is the topper of your batch? Kirti. Who is the topper of this particular subject? Kirti. Who is the topper of individual subjects as well as overall thing? It was Kirti, Kirti, Kirti. So we have this wonderful girl who has done her MD in pediatrics from KM, her DNB, as well as she did her fellowship in neurology. So apart from this, she has been working as a consultant pediatric neurology at Vizag as well as Hyderabad. If I try to bring your attention to the column number 4, that is awards, there you can find that she had been the best student of 2008 batch and as well as best student of Maharashtra. So with this introduction, let us welcome Dr. P. Keerthi Kundana. Hi Keerthi, how are you?
Hi, ma'am. That was a very, very lovely introduction. And
Okay, do you? Yes, yes, please. Yeah.
yeah, yeah. And I feel so welcomed and so warm now. I feel very comfortable.
So do you remember we met at KM ke outside wala canteen
Yes,
few
yes.
years back?
I
We
remember
were there.
we had a very nice chit chat and a cup of coffee. It was really very good of you to remember your juniors, to call them back, to keep them in contact. And not everybody does that, but that's the special thing about you.
You have been special, my dear. Again, you have not changed a bit, not at all. I
And same,
remember
I
your.
should tell to you. I was saying the same thing to you as well, that you haven't changed a bit.
Okay, that's something unusual to come across. Okay. So, Kirti, thank you so much that you could find some time to appear on this platform. And as you know the background, so let me directly start with my question number 1 to you. So, I understand that pediatric neurology is a branch, has been there uh, in the healthcare for a long time now, but still, some of healthcare professionals are not aware who you guys are and what kind of expertise you have. So, can you please throw some light on this?
Okay. So, pediatrics, as we know, that it is a branch related to the healthcare of the kids. Usually, the
Yes.
age group that we see is right from the birth till 18 years of age. But as the medical knowledge advanced, we got to know that there was a lot of advancement in each and every subspecialty of pediatrics. Now let us
Mm-hmm.
compare it with something which is there for adults. Like initial years, it was medicine. So everything came into the realm of medicine. So as the knowledge advanced, people understood that okay, a person who is just trained in a subject called medicine is not trained enough to manage each and every case efficiently because the knowledge was increasing so much. So they decided, okay, let us make subspecialties so that the professionals get themselves specially trained in that subspecialty, and hence, because of additional training, the quality of care that they can give would also improve. The same thing has happened to pediatrics. Initially, it was the pediatrician who would take care of everything right from top to bottom. Any problem in the
Yes.
child, go to pediatrician. He will take care. But because even in pediatrics, the knowledge has advanced so much, like subspecialties have emerged. It's not just about neurology. Now, neurology takes care everything related to the brain. So, pediatric neurology is brain related problems of children, as simple as that. Similar other branches have also come up, like pediatric cardiology, pediatric nephrology, as well as pediatric immunology is also coming up now, and
Oh,
so forth, and pediatric oncology, hemato-oncology. So these are the branches that are coming up slowly. So in due course of time, further subspecialties would develop, and now our branch also is in its baby steps now.
yes, yes. Thank you for making it crystal clear for all the audiences to understand what this specialty is about. So, Kirti, I'll take you directly to the topic uh, for which this platform has been created, that is autism. So, as a pediatric neurologist, how do you cater to autistic individuals? Since it is pediatric, I'll stick to the children, autistic children.
Yeah.
What role you guys have in the management of autism, and who should be approaching you for what?
Yes. So usually, the parents who come to us have their main complaint. Especially, they will have a complaint is that the child is not talking much. That is the usual complaint that we come across at the age of 2 to 3 years of age. Now, the
Okay.
child who is not talking, for me as a neurologist, I have to see why is this child not talking. For me, the problem could lie in hearing. He's not able to hear, that's why he's not talking. The problem could lie that his hearing may be normal, but it's just that he is not able to articulate the words properly. There is a problem in his articulation, that is, the pronunciation is not proper, and that's why he's not able to talk. Or
Mm-hmm.
whether there is a problem in the neuronal circuitry in the brain that is not able to form the words only. So I
Okay.
have to dissect and see where the problem lies. And how do I do that? We have a pattern of approach. We will listen. We have to like spend almost 30 minutes with the child, listen to the story right from the child was in the womb, what all events have occurred, what all the child has been through, and after the child was born, whether there were any insults, whether there were any significant events in the life of the child, and now how he is doing, what is his current development, at what age did he or she started walking, at what age he started babbling. So everything we have to like get into it, dissect each and every information, and try to analyze it. Now, when we do that, we are looking at the child through a comprehensive, holistic approach. That's what we say, a holistic approach to a child. It's not just limited to, okay, someone has told, the parent might come and say, someone has told that my child has autism, you just give treatment for autism. It doesn't work that way. We have
Mm-hmm.
to go into the detail and see, okay, whether this child is really autistic, number one, what could have been the reason for this autism? Is it something related to the child has undergone in the perinatal period or later, or whether it was the environmental influence, or it could be anything genetic? So all these things we analyze. So that is our role, not just to diagnose the symptoms of autism, to say that okay, these look like autistic symptoms, but also to analyze what could have caused it in this child, and is there anything correctable that I can do at this point of time. Is there anything that are there any correctable factors that I am able to identify, and whether correcting them would also improve him, and also as a part of evaluation, what all I have to evaluate in order to come to the cause of it. So that is how we look at into it, and we go step by step, and we evaluate these children step by step. It's not like in one day, 2 day everything is over and then you go back. It's not like that. Sometimes we need 2 3 sit-ups. We have to spend time with the child, examine the child, interact with the child, and that is how sometimes it's very clear in the first visits. Sometimes it takes 2 to 3 visits to come to a conclusion. The one thing which I find that, like, I have had experiences where parents have brought children with autistic symptoms, where we have asked them to stop screen time completely, and within 2 to 3 months they showed a lot of improvement. So there have been instances where it is just the inadequate stimulation from the environment, like in terms of, say, talking to the children or spending time with them or increased screen time. We have seen that they were reversible. That was shocking. That was actually shocking. But such experiences have been shared by other neurologists as well, that we have seen reversibility just by stopping screen time. But yes, it's not always the case. All children do not respond, but yes, some of them do. So that is the first thing we tell, that zero screen time for children less than 2 years of age, and 2 to 5 years of age, just a minimum 1 hour screen time per day, but not more than that. So that is one of the most important correctable thing that I find.
Thank you, Kirti. That was very comprehensive. So, is it possible that in those cases, the diagnosis of autism may not be the ultimate diagnosis, and the children might be showing some symptoms similar to the symptoms of autism?
Yes, yes,
So,
that's what is called as virtual autism these days. So,
okay.
virtual autism, and especially during this COVID time when the interaction had reduced so much, there were a number of children who started showing autistic signs. But as the interaction improved, all these signs became less, and in fact, they were reversible. So that's what I said. In the first sitting itself, diagnosing autism is a bit tricky, and I have also burnt my fingers like that. So that happens. That
Yeah.
happens. So it's always good to give them time, not to label them in the first place. Give them time. Give them that opportunity. Give them that environment of stimulation. Take some correctable steps. Sometimes it do help. Sometimes.
Yes, and probably that is the reason some of the institutions, as well as some of the regulatory authorities, practice that not to diagnose a child up to certain age. I think
Yes.
that could be the reason for that.
Whatever
Thank you for
I would
making.
just like to add here, that whatever psychological tests that we have to diagnose autism, we can apply those after 2 years of age. Confidently, we can apply those tests after 2 years of age. Before 2 years of age, we have something called as checklist, which is called as
Mhm.
MCHAT checklist. We just see the
Mhm.
checklist and see, okay, they are showing the red flags. Red flags means there are certain symptoms, there are certain traits of autism, but that does not
Indicators.
amount to labeling them as suffering from autism spectrum disorder.
Yes, yes. Thank you for making it very clear, because last time also when I was discussing with one of the guests, so this topic was brought up, that how autism is not labeled
Yes,
up to
yes,
certain age. Yes.
yes,
So thank you for making it very clear. So, Kirti, since you were talking about some correctable measures here, one point I would like to uh, get a clarity from you for is, many parents approach me to understand the role of stem cell therapies in autism cure. So, and they come up with some, the data and before and after stuff, and they keep telling me that, see, this child was like this before, and after he received the stem cell therapy, now the child is doing this. So, what is your take on this? Since you are a pediatric neurologist, you would be the best person to respond
yes.
to such
Yes,
claims.
I would just like to quote what all the literature says, what all the studies which have been done in this aspect says. It's not my personal view, it's what the studies say and the
Yes,
research
but
says. So the research says that there is no medication for the core symptoms of autism. By
Mhm.
core symptoms of autism, we mean that is the problems in social interaction, the repetitive restrictive behavior. These are the core symptoms of autism. There is no medicine to cure them. The only thing which helps really these children is behavior therapy, what we call as applied behavior analysis. This is a time proven, tested technique of improving their behavior and their improving their adjustment and everything. That is time tested, proven, and there is also literature supporting that. Coming to the other all form of therapies, be it dietary therapy, some restriction of casein or gluten in the diet, or stem cell therapy, or there were certain other lot of therapies I get to hear. There is no proven benefit. There is no evidence that it has really substantially helped the children. So right now there is no evidence. This is what I would say. And as per my personal experience, also I have not seen a lot of improvement in the children who have taken all these form of therapies.
Yes, thank you so much. And I believe that these therapies are too expensive as well
Yes,
to
yes,
someone to try out.
yes, and they have their
Yes.
own side effects as well. So I would request to because it is not proven yet. So
Mhm.
there is no even we do not recommend it now in our practice.
Because it is very easy to get the parents onto board where someone says that, where someone claims and promises them that your child will be out of something, out of the condition he is having. Then probably the parents, they do not think of anything. I have seen parents who uh, were the economically
Hmm.
not so affluent. So such parents also I have seen opting for the therapy and not seeing the kind of results they were promised. So
Hmm.
that is the thing. And thank you. You actually have given a clarity on this topic. Hopefully, it works with most of the parents, most of the caregivers in our audience. Thank you so much, Kirti. So now another question, since you are into a neurology, so when should a child, I'm talking particularly about the autistic children, should go for uh, this your investigations like EEG, MRI, and all those? What are their role?
Yes. First, I would like to say, like, who should visit a pediatric neurologist if someone is having symptoms of autism? I would say each and every child should be examined by a pediatric neurologist at least once. Why I am
Autistic
saying
child.
autistic child at least once. I'm not saying that be in a regular follow up or something, but at least
Mm-hmm.
once get him examined. Why I am saying examined, because we try to, as I said, we try to look not only into the whether he is fitting the criteria of autism or not. That is not just our job. We also try to find out, is there a cause that I can identify, that I can attribute to as the cause of autism, and that is really important. I try to find out, we try to find out what are the risk factors for this childhood, why this child has developed autism, were there any risk factors. Now by risk factors I mean whether there was any perinatal insult, was there any prematurity, at the time of birth there was an ICU stay, and there was some
Mm-hmm.
kind of stormy course during that perinatal period. Then uh, then environmental influence, as we already know that environmental influence means excessive screen time, inadequate stimulation, and the third and most important thing, whether there could be an underlying genetic syndrome. Now, the chances that there could be an underlying genetic cause for autism is though less, like only 25 to 30%. But it is our job as a neurologist to correctly identify those children. Why? Because it will
Mm-hmm.
have repercussions. It will have repercussions over the next pregnancy. We need to counsel them about the next pregnancy, or we need to even say that, okay, is this a severe genetic syndrome, or is it something a mild genetic condition which will eventually show improvement? So even for the future and the further natural course of events. Okay, so I'll just, for example, I'll quote one example. Like I was one girl had visited me. She was around 3.5 years of age, and she was having all the typical symptoms of autism. But by observing her in the clinic, I could find that she was having some typical hand movements, hand stereotypies, which made me very clear to suspect that this could be an underlying Rett syndrome. So then I went ahead with genetic testing straight away. I need not do MRI for that child because that's not going to add any information for me. I did an EEG. EEG was also showing me some characteristics of Rett syndrome. Then I straight away went for genetic syndrome, which identified the mutation as MECP2. That is the mutation which causes Rett syndrome. Now, diagnosing Rett syndrome is Rett is actually a very severe condition. It eventually becomes worse. Like whatever the child is today, the child may worsen later. So it is that kind of a neurodegenerative kind of a condition. So that helps to even parents to understand, okay, what why my child is like this. And this
Mm-hmm.
family again so the moment we got that genetic report in hand, we counseled the family that okay, there is a risk of recurrence as well, and because this is a serious condition, you go ahead with antenatal testing during your next pregnancy. And they went ahead with antenatal testing that turned out to be negative, and now she's continuing her pregnancy happily without being worried that okay, another child can have this problem. So sometimes those typical clues that we get during clinical examination helps us to find out the cause. Okay, this could be genetic. This could be some kind of a syndrome. That will narrow down the investigations and also like inform. It will be like the parents are more informed and they understand the disease well. So
Yes.
yeah. I would also like to add here, we don't perform MRIs or EEG for each and every autistic child. No, that is not indicated. It is only during the examination or during the history taking if there are certain pointers which warrant further investigation. So it is dependent on case to case basis. Not for it is not a generalized rule for everyone.
Okay. Okay. Usually, whenever we think of neurologist, we think of EEG and MRIs, all those things. So,
Yeah.
thank you for making it very clear to us.
Yes.
So, now, Kirti, we were discussing autism in pediatric neurology setup. So,
Hmm.
you must also be coming across autistic comorbidities in autistic individuals, autistic
Yes.
children in your case. So,
Yes.
what are those and how do you manage those?
Okay. I would also take this chance to explain that whenever we talk of autism, we talk of like whenever we say the definition of autism, it tells the core symptoms of autism is there are two main core symptoms, that is your social interaction and your
Mm-hmm.
repetitive restrictive behavior. These are the core symptoms. But along with these core symptoms, they can have cognitive issues, they can have language issues, they can have behavioral issues, and each and every problem has to be identified in this child. Like if the child will appear to us just like he's very being irritable, he's crying all the time, he sits in the corner, he doesn't want to interact. But we need to understand what all the child is going through, what all problems he has. Is he anxious? Is he having some anxiety problems? Is he having some something called as ADHD or hyperactivity? He is not able to. He is moving all the time because his attention span is less. He is not able to focus. So unless we help him, how is going to become better? So it's very important for us to understand the child, what all he's going through. So regarding that, so he can have cognitive issues, he can have language issues, then sometimes sleep disturbances, even seizures or epilepsy around. Like if I say seizures in a general population is seen in around 1 to 5% of population, but among the autistic population it is a little higher bit of incidence, like around 20% of them can have seizures. So it is little bit higher than the usual population. So seizures, then other behavioral factors. So these are the usual comorbidities which we should also address. And we should not say, oh, just because he is autistic, he is bound to be hyperactive. No, that doesn't happen that way. Hyperactivity is a comorbidity of autism which needs treatment. He may do better with medications. So it's that's why we have to sit with the child and identify his problems.
So it was a really enriching interaction when you said that there are comorbidities, like the some conditions which are associated with autism, जो उसके साथ हो सकते हैं ऑटिज्म के साथ में. फॉर एन एग्जांपल हाइपर एक्टिविटी, where we have medications and that can be taken care of. So
Yes,
as you very well explained it, so if the child is hyperactive, then that child can be helped with
yes,
medications.
yes, yes.
So yes, this is going to be a take home message and very important one at that. So, Kirti, we are at the last stage of interaction, and I am definitely going to call you again, invite
Mhm.
you again on this platform, because you have so much to talk about, and I'm sure there are going to be a lot of queries for you. So, Kirti, what message would you like to give to healthcare professionals, right from general physicians, the pediatricians, and the other specialist pediatricians in for the management of autism?
Yeah. So for the healthcare professionals, my only message would be that autism is common. The incidence of autism today is 1 in 59. It is common. Many tend to think that इसे थोड़ी ना autism होगा. So that kind of chalta hai attitude is what we need to remove from ourselves. If there is a concern, yes, it needs to be addressed. It needs to be evaluated. After evaluation, you find out no, 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 इसको तो autism नहीं है. If you are not able to take a call on it, refer. Refer to a specialist, refer to a psychologist, or to a psychiatrist, to a neurologist, or someone who is an expert in this. But it's always good to refer if things are not clear, because uh, because at that level parents have concerns, they don't know whom to approach. So as a
Yes.
pediatrician or a healthcare provider, we should have, first of all, as doctors, we should have strong index of suspicion. Okay,
Mhm.
someone not, if a child is not talking by 2 years of age, we have to think about the causes. Okay, hearing issues, any speech issues, or autism, we have to keep autism in the differential. Then only we'll think about it, then only we'll evaluate for it. And it is common. So let's accept this fact that yes, it is common in today's world. Yes, we need to address him. It is not like अच्छा इसका दादाजी लेट बोला था तो ये भी लेट ही बात करेगा. That is the most common thing that I hear, and that's why the diagnosis gets delayed so much, that by
Yes.
4 years or 5 years of age autism is not diagnosed at all. Okay, so let's address it. Let's evaluate it. Let's not be afraid of evaluation. That's what.
Okay. Thank you, Kirti. This was very insightful. I think we are going to meet again, of course, if you are available
Yes.
and interested, and we
Yes,
can
I
have a
would.
discussion.
Sorry to interrupt you. I would also like to give a message to all the parents or the caregivers who are there.
Yes.
Like one thing, because I really want to take this opportunity to talk to them, because once that diagnosis is made, no, autism spectrum disorder, parents start crying that, oh my god,
Mhm.
now what will happen to my child, what is the future, Array, how am I going to take care? Because many of the parents are working parents. They are they will be staying in a nuclear family. They have to balance their work life as well as to take that extra care of the child. Of course, you can relate it to Bhavna. So one strong message I want to give them is, do not be, do not lose hope. That's what I want to say. Do not lose hope. Let's try your best. Give your child that opportunity to come up. Tomorrow, what they'll become is, we don't know. We cannot we cannot decide the future. We don't know the future. but just give that opportunity for that child to grow. Give all that love, affection, care, the extra support that that child needs, the extra training and attention that that child needs. So I always encourage my parents. I give them examples of all those people who are, prodigies, being autistic, and but they are prodigies. Some of them are good painters, artists. Some are good fashion designers, and some are good mathematicians. So identify that skill in your child. He may be special. He or she may be special. So it's just that it's our duty to identify that skill in them. So do not lose hope is what I would say.
Yes, that was very enriching, Kirti, and I would like to take it little forward what you
Yes,
just have
yes,
said. So
yes,
there would be cases, where we may not be able to figure out what his interests are, or what our children's, as you said, the prodigious forte is. So even that happens, it is okay. Even if it he doesn't become someone uh, on the expected lines, so that is also fine. It is all about you and your child. So
exactly. Yes, yes.
exactly, yes, yes.
It's your
So thank
bond.
you. So thank you so much, Kirti, and definitely we are going to see you again. And so I again would like you to take us through your credentials, and as well as if someone wants to contact you for online consultation. I understand you are at Vizag and Hyderabad, but if someone wants to go for online consultation, where should he or she should be contacting you?
So I have my website, drkeerthikundana.com. Uh, it's the same spelling which is displayed here,
Yes.
drkeerthikundana.com. Then a link will come for the online consult, and you can directly book from there.
Okay, and I'm going to share the same link in the description
Yes,
of the video as well.
yes,
So thank you so much, Kirti. This was
yes,
very insightful, and definitely it is going to help most of the HCPs who are listening to us, and also the caregivers.
yes.
Thank you
It,
so
it
much.
was my
Thank you
pleasure
for,
to be called here on this platform.
thank you. Thank you for being here for us and for me. Thank you.